here we live in conventional medicine, right? You tend to think of advances in medicine as being very high tech. What's the next medication coming out? The high tech procedures and surgeries, all that stuff is really important for patient care. But what we're talking about here is really taking a step back, simplifying things, and looking at very low tech interventions here that can really help a lot of people in the United States and really globally. Because now, this isn't new information, but more and more people are recognizing that a lot of chronic disease is directly related to poor lifestyle habits.
So that was Ryan Hearing talking about preventive medicine. Ryan Hearing, he's the guest in episode 6 of the Casper Bilton podcast, and he's a plant-based lifestyle medical doctor, and he focuses on treating his patients with diet and not so much with medicine.
And so my heartbeat plays to your song, and it never gets old, it never gets old. Feel my heart ache.
Hey Ryan.
Hey Casper, how you doing, man?
I'm good. How about you? Nice to meet you.
Yeah, nice to meet you as well.
Yeah,
I appreciate the invite here.
Yeah, you're welcome. Where are you at in the world right now?
Yeah, I'm in Southern California.
Nice. Is it hot there, or are you having some winter?
We did have some winter here recently, and it's starting to warm up a little bit now, which is nice.
Okay.
I can't complain. So I'm actually in my third year, my last year of residency, preventive medicine residency.
Yeah.
Here in Southern California at Loma Linda University. Some people may recognize that name.
Yeah.
Loma Linda, is really the Blue Zone's kind of putting that on the map in terms of, a lot of health and longevity in this community, really based around the Seventh-day Adventist faith, which has a strong component in here. And with that does come a vegetarian diet. Yeah, I'm going to be graduating in a few months and officially starting, my first real job outside of residency, which is exciting.
Nice.
But really to kind of go back even further with my journey, I would say, I really got into medicine, at least wanting to pursue medicine based on my own experience as a patient. I actually had a lot of sports-related injuries growing up myself, kind of late middle school, early high school. And that was the first time I really got to experience what it was like to, what I perceived as, good quality care, getting me back to doing what I love to do, restoring my quality of life. And I just loved the way that felt.
Mm.
And I originally considered pursuing either orthopedics or sports medicine. But actually I had quite a dramatic change in sort of how I viewed our current healthcare system, at least in the United States.
Yeah.
And sort of, where things were at and where things were really headed. And this kind of came actually in college after I'd already, started pursuing my bachelor's degree. It was about in my third year in college at university I actually came across a handful of practicing physicians who, were talking about plant-based nutrition. And I've never heard of this before. I was like, this is a really radical idea. I didn't realize that you could only eat plant-based foods and live a long and healthy life. And as there's many reasons why we're growing up, we're taught, how we're supposed to eat a certain way. You need certain foods from meat or dairy products to grow up strong and healthy. And that's just what you were taught. That's the culture. And that's what a lot of people really believe at really the hands of the food industries, I would say. And I just kind of had this like light bulb moment where you had all these real pioneers, in lifestyle medicine and the plant-based movement, people like Dr. Esselstyn,
Mm.
Dr. John McDougall, Dean Ornish, all these guys, I had this like light bulb moment. I was like, they are talking about something that's really important here. They're actually relating all of the chronic disease in the United States and really globally to poor lifestyle habits, primarily a suboptimal diet. And I
Mm.
was just like, wow, you know, here we live in this in conventional medicine, right? You tend to think of advances in medicine as being very high tech. You know,
Yeah.
what's the next medication coming out? The high tech procedures and surgeries, all that stuff is really important for patient care.
Yeah.
But what we're talking about here is really taking a step back, simplifying things, and looking at very low tech interventions here that can really help a lot of people in the United States and really globally. Because now, you know, this isn't new information, but you know, more and more people are recognizing that a lot of chronic disease is directly related to poor lifestyle habits.
Yeah.
So, so I went into medical school with this knowledge sort of in the background of plant-based nutrition, that there were people literally healing and reversing disease
Mm.
with a whole food plant-based diet, and other important lifestyle behaviors that we can talk about as well that are really all part of lifestyle medicine.
Yeah.
And you go into medical school. I was, you know, very hopeful to get to have that be foundational to my medical training, but you know, it really wasn't. And that's not uncommon. You know, majority of medical school curriculums are, you know, they really emphasize pathophysiology, really understanding disease, being able to assess and diagnose disease, and then often the intervention is usually medications or, you know, referrals to receive further workup, possibly procedure and surgery. You know, for a lot of patients, they do need that, but what's missing, what's really foundational to that is that piece on the lifestyle medicine, which is often what, you know, got them there in the first place.
Yeah.
So
Were
I
you
re-
like when you started your education, were you plant-based then, or was it during the education you found out?
yeah, I went plant-based in my third year of college there. It was almost like an overnight decision.
Okay.
After I'd come across these physicians talking about plant-based nutrition, it just made so much sense to me, and I was like,
But
I need
how
to do
come,
this.
why did you find out? Like, how did you find them? Because I saw, like, I think it's hard to find the stuff if you don't look for it.
Yeah, you do have to look for it, and that's really what I did.
Okay.
It was around the time I was applying to medical school, and I'm actually coming from a background too where I had interest in engineering as well. So I'm a systems thinker, a big picture person,
Yeah.
and I wanted to have that kind of knowledge of what kind of the big picture of our healthcare system was going into medical school.
Yeah.
And so that's where I just happened to stumble across some, you know, TED Talks, different YouTube talks of these plant-based physicians. So
Yeah.
it was almost by luck, but you know, I did search it out.
And who did you find out first?
It was really Dr. McDougall.
Yeah.
Yeah,
That's,
he's a very prominent speaker, a very
yeah.
passionate speaker. He tells it like it is.
Yeah.
He's been doing this for decades. He, you know, has a medical center in Northern California here
Yeah. Did you
where
get
he
to meet him?
takes. I have met him at conferences. Yeah,
Okay. How is he? Like, is he nice in person as well?
he is. He's a nice guy. He loves. It seems like he likes talking to medical students and residents, people that are in training.
Yeah.
He wants them to know this message.
Yeah. Well, I think he's really like he's actually the person also I would say like influenced me the most. That's McDougall because I feel like I saw Forks Over Knives first, and then you kind of hear those, like, I think it's Esselstyn and Campbell's story. Like you follow these two, and then you have McDougall. He says something sometimes in this, and then when you look the doctors up, then McDougall is like the one who kind of just say stuff to your face. Like he doesn't care how you react. It's like, and like I like that he spoke like that to me, because that hit me a lot, because I was like, okay, this, like, if he speaks like that, then he means it. And that's when I'm like, okay, then I should probably like look more into this.
Yeah, that's exactly how I felt when I first heard him. He's just he tells it like it is, and he's the kind of guy that in his career, what I've been told, or I've actually seen in different videos, he will actually stand up, in different conferences and really kind of call things out like this is how it is, and it gets a lot of people's attention. And it's important though, because we need people like that can tell the truth and coming at it from a place of a lot of experience and just a deep, deep passion to heal people. So
Yeah.
it's really inspiring.
Yeah. You think you're gonna take some of that, like that way of doing it, to do it yourself that way?
I don't think I'm quite as outspoken as
Okay.
as Dr. McDougall, but yeah, I do think it's important, right? Especially all physicians, any healthcare professional in this space really has a role to spread this message, however that looks for them, however they're comfortable doing it, whether it's on social media, conferences. Just spread the message, because we need to get more and more people in this space and community.
Yeah, totally. And like he also got, like, I think he won some award from that lifestyle medicine school, right? So you
Yeah.
have like, and you have what's that school called? You have a connection to that school, right?
Yeah, that's the American College of Lifestyle Medicine,
Yeah.
which is really the official professional organization
Okay.
that founded that put lifestyle medicine on the map in terms of in a professional capacity. They founded in 2004 and have really seen just a dramatic increase in membership. I
Mm.
think even in the last 5 years, they've gone from something like 600 members up to over 5,000 members
Wow.
of people that are really interested in this. They want to know how to do it
Yeah.
in clinical practice, wherever they're at in their career. And it's really expanding globally too.
Yeah.
There's the Lifestyle Medicine Global Alliance, which is kind of the convergence of lifestyle medicine across the world. There's different nations that have sort of like ambassadors to the
Okay.
American College of Lifestyle Medicine to really bring it to their nation.
Yeah.
And so it's a huge collaboration. It's for any health professional, not just physicians,
Mm.
nurses, nurse practitioners.
Well, how does it work?
So it's really about building a community around this.
Okay.
You have all the pioneers in plant-based nutrition and lifestyle medicine, the people that we think of that we've talked about so far.
Yeah.
Uh, they're the ones that are giving a lot of the presentations, but we also have more and more members that are practicing physicians and other health professionals that we have an annual meeting, typically in person, around the United States. It was virtual last year, or this past year, a few
Yeah.
months ago, which I think was actually an even greater benefit because it allowed even more people to tune in from wherever they
That's
are in the
true.
world.
Yeah.
And so it's the American College of Lifestyle Medicine, their mission really is to make lifestyle medicine foundational in mainstream medicine.
Yeah.
And so it's a community of all these health professionals sharing ideas, networking, and really showing you how to bring this into practice.
Yeah. So I just gonna, because I just thought of a question that popped up in my head while we are talking about McDougall, because he also gets a lot of hate sometimes. And why do you think that happens? Because I feel like the more I dig into it, like his knowledge is quite, I would say, true and straightforward, and he doesn't really explain, like it's really simple what he tries to explain people, but at the same time he gets a lot of hate from different people. Like, why do you think that happens?
Well, I think that comes naturally with being a very outspoken person,
Yeah,
telling the truth like it is. And he kind of coined this phrase that really reigns true here, and it's that people actually prefer to hear good news about their bad habits, right?
yeah,
In terms of their lifestyle habits. And when someone stands up and tells them something different, it a lot of people take that personally,
yeah,
and they don't want to believe the evidence, even though it can be right in front of them. A lot of people, especially health professionals, are not trained on this area of medicine, right? It's not front
mm,
and center just yet. And so it can be hard to believe that something so simple can be so healing and powerful.
yeah, yeah. And then I kind of want to jump back again to you, like what specific moment you said you had some injuries that got helped by your diet. Can we talk a bit about that?
Well, the sports injuries were what really got me interested in medicine itself. At
Okay,
at that point, I had no idea about plant-based nutrition.
okay,
Still kind of eating the standard American diet, how I was
yeah.
raised.
But how about back then? Like, what did you figure out there? Because I actually, like, that caught my attention because that I come from like a really sporty community, and even though when I was young, I probably, one of the reasons why I wanted to be an athlete, because I saw those people as like the most healthiest people on earth, because like they use their bodies, and like they just live by like working out and stuff. That must be like the healthiest diet. And then I came to one of like these professional teams, and even also before I was plant-based, I actually thought like these was actually some of the most unhealthiest people I knew. So I would like to hear what was the first, even though it's not plant-based, but what was the first thoughts in your head from maybe like a sports background on that nutrition actually can help a bit?
Yeah, I would say that in terms of using nutrition for sports performance, particularly for recovery, right?
Yeah,
I think that's what makes the most sense for me, because if you're a professional athlete and your salary, your job depends on you performing and not getting sick, not having injuries, and performing at a high level fairly constantly, right? You want to maximize your ability to recover with nutrition.
yeah,
And so I think a lot of athletes tend to think of, right, it's the protein that plays maybe the most important role in terms of recovery. That's
yeah,
kind of what's ingrained in your head, but it's really much more complex than that, as you know. That protein is certainly important, especially if you're, in a more demanding sport, especially like bodybuilding and things like that, and that require a lot of contact. You really have to look at, I think, the totality of your nutrition, right? Of course, you
mm,
want to meet your calorie goals.
yeah,
I think that some people who fear eating more plant-based, that may be one reason why, because you do have to eat a much higher volume of food to meet calorie needs.
yeah,
I think
right,
on a plant-based diet compared to a more meat-based diet or even a processed diet. But what's coming with that volume of food in terms of whole plant foods, right, is just an abundance of anti-inflammatory compounds, antioxidants, vitamins and minerals that you need as an athlete to recover.
yeah,
So just getting people to think about food as nutritional packages
yeah,
versus isolated nutrients, I think goes a long way. And it
mm,
goes a long way for treating patients as well.
okay, yeah. But hey, let's dig into like the lifestyle medicine and just really simple, like what is it?
Well, the American College of Lifestyle Medicine has a formal definition of lifestyle medicine. It's really
Okay.
about addressing the root cause of disease with evidence-based lifestyle therapies. And they talk about 6 lifestyle pillars, which are
Yeah.
really the foundation of what we're talking about here. And that includes a whole food, plant predominant diet. That's
Mhm.
number 1. 2, regular physical activity, stress management, restorative sleep, positive social connections, and then trying to really minimize or avoid risky substances like tobacco. And so using these lifestyle interventions to not only prevent disease, but really as a first line treatment option,
Mm.
I think is really the paradigm shift we're talking about here in terms of lifestyle medicine, because um, the idea of lifestyle counseling is certainly nothing new to conventional medicine. In fact, anyone who's gone through medical school, who's a practicing physician or any kind of provider, they know that nearly all major chronic disease management begins with lifestyle intervention.
Yeah.
The problem is it just you haven't clearly defined what lifestyle intervention is, right? A lot of people, especially physicians, tend to give just generic advice like you need to eat more fruits and vegetables, you need to lose weight, be more active. That's very generic advice that doesn't
Yeah.
really help a lot of patients.
No, because you can also twist those advice a bit.
Yeah, yeah, absolutely. So if you're giving generic advice, I think it there's a lot of temptation for the misinformation to come into play, which is just rampant in terms of nutrition. And so we really need to train physicians on good evidence-based lifestyle medicine. And the key word being evidence-based here, um, because physicians are really trained on following evidence-based guidelines for all
Yeah.
of their treatments. And that's how it should be. It should be based on good, solid evidence.
Yeah.
And so what we're talking about here is really blending those.
Yeah.
But the foundation really being built on lifestyle medicine as a primary treatment option, but also drawing upon the typical conventional medical therapies as well.
Yeah. And so if we can we dive down and be a bit more like, or how do you say that, a bit more precise on what the diet should look like, and then we can maybe jump over to the sleep and so on.
Yeah, I think that'd be good to go through all of them.
Yeah, yeah, just
Um,
yeah. So let's
so
start with the diet. Like how should that, like a regular person's diet look like then if it's not how we're eating now?
yeah, well, in terms of if we come from the place of a standard American diet
Yeah, let's do that.
or towards, a more optimal diet, the standard American diet actually is, typically about 2/3 coming from processed foods and oils, maybe a quarter to a third from meat and animal products,
Mm,
and then a much smaller percentage of that from actual whole unprocessed plant-based foods. And so the shift, right, would be to get more, as much as possible, of the whole food plant-based on your plate. And what we're talking about here is, of course, fruits and vegetables, but whole grains, a lot of legumes like beans and lentils, and then healthy sources of fats, nuts and seeds, avocados. That should be the bulk of your plate. And so we're trying to really shift the makeup of the plate to incorporate more and more of those foods front and center,
yeah.
and getting the meat and animal products and the processed foods to be a much smaller component, and ideally even off the plate. And so that's the main dietary pattern that American College of Lifestyle Medicine really advocates for, because it is based on the best available evidence that we have
Mm,
for disease prevention, but also as therapy for treating chronic disease.
Yeah. Are you also on the path with McDougall with the center should be mostly like from a carbohydrate or starch?
Well, I think that I would say that the majority of my plate is coming from carbohydrates
Okay.
in terms of total calories. I
Yeah.
think that, yeah, there's a lot of flavors right here of what whole food plant-based can look like in terms of the percentage breakdown of the macronutrients.
Yeah.
You know, should we be eating mostly a whole carbohydrate based diet with smaller amounts of plant-based protein and then some healthy fats thrown in there? I think that by and large, I think the overall percentage breakdown is less important here
Yeah.
as just getting more people to get the unprocessed plant-based foods on their plate.
Yeah.
And so that's really how I approach it when I'm talking with patients.
Okay.
And of course, lifestyle medicine, it's really about the clinical application of this in routine practice when you're seeing patients,
Hmm.
especially when you talk to them about nutrition, right? It can be a very in-depth discussion because patients are coming in there with certain ideas about nutrition.
Hmm.
We, as providers, of course, we know what the evidence says in terms of nutrition if you study this and you're in this space. But this is really where lifestyle medicine shines, I think, in terms of the patient-physician relationship here. You really want to take an approach here of partnering with your patients, sort of meeting them where they're at,
Yeah.
taking a step back and really listening to, what their particular health goals are, what they want to do in terms of their nutrition, but also offering a lot of guidance and support and really helping them to build the skill power to change their daily habits.
Yeah.
Because really, the willpower, a lot of people, we talk about willpower when it comes to nutrition. That's for most people, it's just not enough. They really need a set of skills to go out in their world where they're constantly bombarded with different information, influences in their environment.
What kind
And
of
often,
skills are you talking about? Like, is it like if you can give an example?
well, motivational interviewing is really what I'm talking about here. Um, and it's really a practice that I think all healthcare professionals should be competent at.
Yeah.
And it's really kind of taking a more collaborative, coach-based approach here with your
Oh yeah. Okay.
patients
Yeah.
versus what some people tend to think of in terms of medicine, right? You kind of just go to the doctor, they tell you what to do,
Yeah.
and they send you on your way.
Yeah.
We're talking about fostering a lot of collaboration here
Yeah.
with patients. So you're really, I think, restoring and renewing that relationship with patients by taking this approach.
Yeah. It's also, I think that probably must come from that, like one side with the lifestyle medicine is about changing habits, while the other one is maybe not so much about changing habits. It's more like, I don't know what they do, to be honest.
Well, yeah, you're right. I mean, a lot of patients, they may come into this without even having any awareness that they may need to change their habits,
Yeah.
right? That's not even on their radar. And that's what I really mean about meeting patients where they're at. You have to be able to really assess the readiness of a patient
Yeah.
to make these lifestyle changes and not be forceful because the patients are the driver here. You're kind of the co-pilot and you really want to have that kind of collaboration with patients. And I've really found that is very sustainable from both the provider side, but also the patient side of having that kind of experience with your patients.
Yeah. What patients do you see the most, like who sign up for this type of medicine?
Well, these are patients dealing with a lot of chronic disease. It's
Okay.
it's really the typical American. But out in Southern California here, we do have a large Hispanic population,
Okay.
which often they are disproportionately affected by chronic diseases,
Yeah.
often having two, three, or more chronic diseases at one time that they're dealing with. And so these are patients overall that, about 6 in 10, so 60% of Americans have at least one chronic medical condition like, high blood pressure, cholesterol issues, diabetes, um, obesity. But actually 40% of Americans, and this trend is probably going to continue to increase
Mm.
unless we really do something about it. 40% of Americans actually have two or more chronic medical conditions.
Yeah.
So once you realize the patients, what they're coming in with, what is really affecting their quality of life and robbing them of good quality years, you recognize that the chronic disease is really rooted in really an accumulation, a lifetime of poor lifestyle habits.
Yeah.
And so, as you can imagine, right, it takes a lot of time to change those and start to undo things that we've just ingrained into how we approach our lifestyles.
Mm. How is the results when you get these people in? Do you think does it happen fast, like with the reversing or just them getting better?
Yeah, there's a lot of factors that go into that. It really depends on the state of health of the patient. How long have they been living with a certain chronic disease?
Yeah.
Ideally, right, the lifestyle medicine is often more effective earlier in the disease course,
Yeah.
and ideally as a preventive approach. But there's accumulating evidence that the lifestyle medicine can be very therapeutic,
Mm.
um, even in more severe disease states. Severe ischemic heart disease, early stage cancers. That the lifestyle medicine, if it's appropriately dosed to patients, I think that's a really important thing to talk about here with lifestyle medicine. Is we were talking about how often the generic advice is not really effective for patients. So just like physicians are trained on properly dosing medications to be therapeutic, we really have to understand how to properly dose lifestyle medicine to match the disease state.
Yeah.
So the more you can become informed about what the evidence says for using lifestyle medicine, the better you can be at actually dialing that in for patients. And so, it's not uncommon for patients with diabetes, for example, type 2 diabetes. I really consider that to be kind of the low-hanging fruit here
Yeah.
in terms of a reversible lifestyle-related disease.
Yeah.
And actually, if you properly dose a good therapeutic lifestyle medicine intervention with appropriate nutrition, oftentimes we're talking about incorporating whole food plant-based nutrition, often at um, a calorie deficit, but allowing patients to really fill up on these low calorie plant-based foods.
Mm.
That you combine this whole food plant-based nutrition with some physical activity, really optimizing their sleep, you can actually see reversal of type 2 diabetes within a matter of weeks, and actually within a few days. If you were to measure their blood sugar levels, you can actually see normalization of the blood sugar levels within a matter of days.
Yeah. How does that
Even
work? Like, why is plant so powerful on the type 2 diabetes?
Yeah, what we're really seeing is that the plant-based nutrition is actually addressing the root cause of a diet-related disease, type 2 diabetes, primarily being the result of chronic excess calorie intake, mainly in the form of processed, refined carbohydrates, but also an excess intake of dietary fat, especially saturated fat,
Yeah.
coming from meat and dairy and eggs. So as you can imagine, if you dramatically reduce or eliminate the foods that are causing the type 2 diabetes, and the way that's happening is your muscle cells are normally the ones that take up the sugars that you
Mm.
eat. The
Yeah.
carbohydrates, all the sugars usually go to the skeletal muscle, but actually with even after a high calorie processed meal, you can see acute insulin resistance, meaning that insulin is kind of like the key that your pancreas releases when it senses that there is sugar in the bloodstream. And that insulin is what allows the blood sugar to actually be taken up into skeletal muscle.
Yeah.
And so, but the problem is that mechanism of insulin and the ability of muscle to take up the carbohydrates and the sugar can get very dysregulated by a poor diet. And mainly because the excess dietary fat can start to actually deposit inside of the skeletal muscle, really disrupting the signaling and the ability of the muscle to take up the sugar.
Yeah.
Over time, though, um, as you constantly are eating in excess of calories, right, you're putting on more and more body weight. You're
Mm.
filling up your fat cells that can store a lot of excess calories, but eventually they become full, and that those excess calories and excess fat have to go somewhere in the body.
Mm.
And eventually it starts depositing in the liver. So you get a fatty liver. You may have heard that term before.
Yeah.
But fat can also start to deposit in the pancreas itself, which is where the insulin is coming from in the first place.
Okay.
So this is where you see patients down the road needing insulin replacement just to try to manage their blood sugar because their pancreas is so dysregulated that they're not even making enough insulin now. So
Yeah.
it's a vicious cycle here
Mm.
of poor nutrition. And so when you start to actually remove the excess fat, reduce the calories to a more optimal intake, and at the same time flood the body with the nutrients coming from whole plant-based foods, you
Mm.
can reverse all of those cycles. All of the underlying problems there with type 2 diabetes can actually be reversed with
Yeah.
plant-based nutrition.
One of the things like I've also what I understand what you're saying is that if you have like the muscle cells, like the fat can also like lay around the muscle cells and kind of like like lock the muscle cells from not taking like sugars in. Could that?
Well, it's actually more of an issue of fatty deposits actually depositing inside of the muscle cell
Ah,
um,
okay.
on the membrane of the cell, which is where
Yeah.
a lot of the magic happens here in terms of insulin unlocking the door to let sugar in.
Yeah.
But the thing you're talking about is really more of what we call visceral fat. Uh,
Okay.
Eventually, a lot of organs and inside the abdomen, you can have a lot of fat buildup around the organs themselves.
Yeah. Okay. Yeah. So that makes sense. That would lock down lots of stuff in us. Um, what else do you see? Like which diseases is more easy to get rid of while using these lifestyle medicine principles?
Yeah, certainly high blood pressure,
Yeah.
um, high cholesterol.
Actually, like I have a friend who is dealing with high blood pressure and all the numbers, and we, to be honest, like we also don't understand it 100% because there's a lot of different ways to measure it, I think. So how does that work? Like, how does the high blood pressure work and with diet?
Well, hypertension, high blood pressure, it in terms of being related to nutrition, we're
Mm.
really talking about a few different things happening. Of course, with excessive sodium or salt coming
Yeah.
into the diet.
Yeah.
That tends to raise blood pressure itself. The artery walls themselves, they need to be very flexible and be able to respond. And over time, they can become stiff because of poor nutrition and excess fat actually depositing in the walls of our vessels makes them much stiffer. And so that can certainly raise your blood pressure.
Yeah.
But, there's other things even besides nutrition itself, like chronic stress, poor sleep, not getting good restorative sleep can raise your blood
Mm.
pressure. So you really need to take a look at the full lifestyle, I think.
Yeah. What is high blood pressure? Like what's the definition of that?
Well, I guess it really depends on what guidelines you're going by.
Okay.
Uh, the American Heart Association, they have lowered their guidelines
Okay.
to diagnose hypertension as 130 over 80. Um, Other practitioners may follow the typical guidelines of 140 over
Yeah.
90, but
Well,
it also, you need to take into account.
yeah.
Um,
I was more thinking about like what happened, like when somebody is uh, is told that, oh, you have high blood pressure. Like what is it that the body then does?
in terms of potential complications of that, or
Or what is, like, it's more like what it is, like is it the heart like pumping more blood around? Is that what you're, or how is it, how do you measure it?
well, I mean, of course you're measuring the blood pressure itself with a blood pressure cuff,
Yeah.
but yeah, it's not that you're having an excess of blood itself. It's really about the ability of the blood vessels to kind of relax into a normal state
Okay.
to accommodate the normal blood flow throughout the body. So
Yeah.
that's kind of the simplified version of that. But I think your question about, what chronic diseases can actually be effectively treated, at least
Mm.
to some degree, with whole food plant-based nutrition and lifestyle medicine. I think that there's really potentially no limit to that, because um, really the leading chronic diseases in the United States, at least, are directly related to lifestyle, mainly to nutrition, not enough physical activity, and smoking.
Yeah.
So if you can just address those factors themselves, we're talking about the ability to actually potentially prevent 80% of the chronic disease burden.
Yeah.
And that extends globally too, because a lot of nations are experiencing similar rates of chronic disease.
Mm.
So I really think that lifestyle intervention should be offered to all patients who are
Yeah.
suffering with chronic disease.
Would you still use like other medications while?
Yeah, absolutely. I mean, lifestyle medicine should not be seen as a standalone practice here. We're talking about
Okay.
blending
Yeah.
it with conventional medicine. You still need to follow evidence-based guidelines
Mm.
for all chronic diseases. So patients who would benefit from medication should absolutely receive it.
Yeah.
But of course, that you have to have the discussion with patients, right? As you move away from lifestyle medicine, which tends to be low cost and very low risk, often with only good side effects. As you move away from that towards needing more and more medication or procedures and surgeries, you see healthcare costs go up for the
Mm.
patient as well. But you also see increased risk associated with that. So the discussion about risk benefit becomes even more important here when you're
Yeah.
talking with patients. They need to have informed consent about all the things that they're receiving, but with the expectation that all physicians should be still be following evidence-based guidelines in terms of conventional medicine.
Yeah. And like how do you, or like how do you feel about, no, that's not how I would say. I would say that how should we get more physicians and doctors to like think this way?
That's a great question. And there are a lot of things that are in process right now to expand this, to get lifestyle medicine in universities, in medical school education, in residency training.
Mm.
One of the things that I'm really excited about in terms of training, residency training, is the lifestyle medicine residency curriculum, which was a collaboration between Loma Linda University, my program,
Mm.
and the American College of Lifestyle Medicine. And the idea here is to create a comprehensive curriculum that highlights and summarizes all of the best evidence for lifestyle medicine in terms of lectures and didactics, but also provide a space for the clinical application of this, requiring that if you're going to participate in the curriculum here, that you have the opportunity to see a certain number of patients and actually document that you've talked to them about lifestyle medicine.
Yeah.
So I think it's getting close to at least 30 programs in the United States that have adopted the lifestyle medicine residency curriculum.
Mm.
Beyond that, though, with ACLM, I'm have been a part of the executive trainee board for 3 years now, and this is where people like myself and other health professionals that are in training, including students of any health profession, this is where we're getting together. We're building a community to spread this message to all of the campuses and really encourage people to start lifestyle medicine interest groups at their campus.
Mm.
And so it's really a multi-pronged approach here.
Yeah. So how about if somebody who's listening to this, or they just figure out like they're a doctor or they're a physician or they're a dietitian maybe also, and they figure out like us, whole food plant-based is the way out. I want to connect with more people, because like even like in Denmark here where I am, like I know a lot of people in the community, and I only know like 2 dietitians and 3 doctors who promote this in like whole Denmark. Like where should they like how like where should they go to get the support or the community as like you're talking about?
Well, if anywhere you're in the world, I would become a member of American College of Lifestyle Medicine. You
Okay.
get a lot of benefits from doing that, including almost unlimited resources online, a community to network with people, the opportunity to attend these conferences and learn from the real pioneers who are doing this. If you are not living in the United States, I would try to connect with the Lifestyle Medicine Global Alliance,
Mm.
which is sort of the global extension of American College of Lifestyle Medicine, and see if you can find a mentor who's a part of this in your area or somewhat nearby. Just try to connect with them. You can host different events. It's really exciting, right, to host different culinary events and actually show people how to make delicious and healthful food.
Oh yeah, I saw on your Instagram that you were a part of some of that. How did that work out? Because we have the restaurant here, and we actually also want to try to, for the future, not just have people to sit down and eat, but actually get out and learn other chefs, like how to make this type of food. Like how did that course work out? How did they start it all?
Well, this is actually an ongoing project at Loma Linda at our preventive medicine and also family medicine residency programs. It's actually a hands-on cooking experience, but it's also meant to be educational.
Yeah.
And we're actually doing an 8-part chronic disease series where we go through eight of the most common chronic diseases and actually create a event out of those, where we start with a educational piece, and then we actually go into hands-on cooking.
Mm.
And we were, doing this in person prior to the pandemic here.
Yeah.
And it was really awesome because we could partner with dietitians and even chefs in our local area here and have this collaboration to give residents, this was primarily meant for residents,
Yeah.
to give them the hands-on experience with actually cooking with these healthful ingredients.
Yeah.
And so we had to convert it to virtual the last couple of times here, but it's still been a success.
Oh, nice. Okay.
And really what we're trying to do with this is teach residents how to write good nutrition prescriptions,
Yeah.
and really trying to dial in the whole food plant-based nutrition with specific chronic disease states.
Mm.
And so it's really valuable to have that tool when you're counseling patients,
Okay.
to give them very practical and evidence-based recommendations of how they can tackle their chronic disease effectively with nutrition.
Yeah. 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 I think that's the right way to do it. Like if I had to pick one, like get people, like sit down, talk about like why we're eating this food, and then make the food together, like just to like try the vegetables and see what they can do and just feel the energy level after. I think that's a really powerful tool to show this off. And maybe
Absolutely.
I'm really interested in starting something like that here because there's like nothing here on that. And I think so many people, they're having that question that, oh, it's hard to make plant-based food taste good, or I don't know how to do it, so I just pick my like easy recipes, and that's what their habits are, and that's why they fail in being healthy. So it is like trying to shift their old like their old easy recipes, and then do some new easy recipes that's just within like the whole food plant-based.
Yeah, it's a really powerful tool. We're talking about learning and healing through community, right?
Yeah.
That's the power of doing this as a community.
Yeah, that's right. That's awesome. And like just here on the last of the talk, like what are you working personally on at the moment?
So in terms of personal lifestyle habits, I would say, the two that I think that not only myself, but I think a lot of people would benefit from, especially during this time, is really trying to optimize your sleep.
Okay.
Getting that restorative sleep is really the foundation or the fountain of youth in many ways.
Yeah.
And then trying to build a lot of positive social connection here.
Okay.
We
How
know
come
that,
sleep is so important? Because isn't it just stay up late, work hard, and then wake up early and work hard again and be successful?
yeah, it'd be nice if it were that way, if we could all function optimally, have a long, healthy life on minimal sleep, just be robots.
Yeah, yeah.
Yeah, we need that deep restorative sleep, at least 7 to 8 hours a night
Okay.
to really benefit our emotional health, but also our physical health.
Yeah. But what happens if we don't get that sleep?
Well, with chronic poor sleep, right, you see higher rates of cardiovascular disease,
Hmm.
poor mental health outcomes like depression, anxiety, and
Hmm.
it's even being implicated now in a lot of cognitive and things like dementia, Alzheimer's, because a lot of magic actually happens in the brain when you're sleeping. The brain is actually essentially cleaning itself while you're
Yeah.
getting into that deep, restful sleep.
Yeah.
Um, and so when you're not getting that deep, restful sleep, you're not able to clear out a lot of waste and toxins and things like that that can accumulate with chronic poor sleep.
Hmm. Yeah. So that's like good diet, good sleep, and then you should be on your best level, I guess.
Yeah, there's, of course, it'd be great if we could all work on these things simultaneously, right?
Yeah.
Because the real beauty with with all the 6 pillars of lifestyle medicine is that once you start working on one, right, you often get benefits in the other ones.
Yeah, yeah, that's true.
They're so interconnected, just like the body as a whole is so interconnected. These areas of lifestyle, they all really reinforce each other. So as you can imagine, right, if you start eating healthier, you're
Mm,
probably more likely to get regular physical activity.
mm,
And when you're getting the regular activity, you will have reduced stress levels. You'll feel more joyful throughout your day. You'll probably sleep better,
yeah.
and you'll be more connected, I think,
Mm,
um, with not only yourself but those around you.
yeah.
So that's really the beauty here of working on these different
Yeah.
areas.
Well, that's actually what I like most of from the plant-based thought, like the lifestyle, because I feel like when people who has like they're maybe obese or they need to get in shape, like what you hear is like you need to exercise more, like you need to burn the fat. But I don't believe it's like, or you can, of course, but it's harder and it's not as fun. So what I like that from the plant-based is that they think about the plants first, the diet first, and then when you change your diet, you actually feel, like you said now, more likely to do activity. Where when normal dietitians, they sometimes do this the opposite, where they first kind of say like, now you need to go out, start out with walking, and then try to see if you can run. Like, so that's a lot of pressure on people who aren't healthy enough to uh, do exercise. What I think, where it's like the plant-based way to is I think that's just a so logic way, and then you just do it by like what you feel, I think.
Yeah, the really working on the nutrition piece here often gets you a foot in the door, like you're saying, to these
Yeah.
other areas. But I do think, though, that being a good lifestyle medicine practitioner is being able to recognize in your patients
Mm,
which of those pillars they're actually wanting to work on.
yeah.
It would be ideal, yeah, to start with in nutrition because far often than not, the majority of the chronic diseases are directly related to the poor nutrition.
Yeah.
And we know from very large studies that poor dietary risks, the global burden of disease study, which is really the largest study ever conducted to look at
Mm,
different lifestyle and other risk factors for developing chronic disease and dying prematurely. Dietary risks were at the top of that list. Um, Also globally, not just in the United States, but really globally, you see that on that list of risk factors, poor nutrition number one, but really the majority of those risk factors, I think at least 7 out of 10 of them were directly related to lifestyle.
yeah.
So yes, ideally, patients, if you can get them to work on nutrition first, that would be ideal, but it shouldn't be a limiting factor. You should be able to work with your patients and figure out what they're really wanting to work on in terms of lifestyle.
Yeah, yeah, yeah. That's true. That's true. That's awesome. And when are you finished with all of your school?
Yeah, I'll graduate in June of
Okay.
this year from residency. I actually recently did sign a contract to start my first job. It is going to be a clinical lifestyle medicine job, which I'm super excited for.
Where at?
In Southern California here, actually pretty locally to where my program's at.
Okay. Nice.
So I feel incredibly fortunate and very grateful to have been given this job opportunity. And I'm really excited to take everything that, I've been really working on and perfecting
Hmm.
and trying to model in my own life and really bring that to the patient care.
Yeah, yeah. And so like this last half of a year at school, like what do you need to, is there any papers you need to hand in, or how does it look?
Well, typically residency training is less school focused. You're
Okay.
kind of, you're not really in the classroom. You're actually in clinical practice
Yeah,
trying to, become a competent physician on your own.
yeah.
But the unique thing about preventive medicine actually is I've been working on a master's degree in population medicine.
Mm-hmm.
It's actually a requirement as part of preventive medicine residency
Okay.
is to get this population medicine piece. And so I do have weekly assignments for that and an
Yeah.
ongoing project that I've been working on. So it's very busy at times, right? To do kind of the routine residency clinical practice, but also be working on this master's degree
Yeah.
kind of in my spare time.
Yeah.
But I think that putting those two pieces together gives you the perspective of knowing how to do individual patient care, but also recognizing that your patients are living in a very complex world. They're under the influence of a lot of social determinants of health within their environment.
Mm.
And so having that big picture view of population health is really beneficial to understanding how to assess and actually intervene in communities
Yeah.
and in large populations.
Yeah. Agree. Yeah. Yeah. So good luck on that. And that's going to be exciting for you. Yeah. Thanks for having this talk with me. Like, thanks for letting me use an hour of your time. Like, it was amazing to talk about like lifestyle medicine and just that. So to spread out like this concept, because there's a lot of doctors who can change, I believe. So really nice to meet you, Ryan. Thank you for all that.
Yeah, I appreciate the talk here. I also really appreciate the work that you're doing in your
Thanks.
community there.
Yeah.
We need everyone here,
Yeah.
no matter what angle you're coming at this. Just spreading the message and trying to be a good role model here.
Yeah.
And just building a community around this.
Yeah, I
think
agree.
we can all really heal together. Of course, I'm happy to engage with anyone if they want to message me on social media. I'm usually pretty responsive there.
Yeah, so it's okay for people to just write you there if they want to talk a bit with you?
Yeah, if they have questions about getting into lifestyle medicine or medical school residency, I'm happy to speak with them.
Okay, awesome. I'll say that. Yeah, thanks for that, Ryan. Thank you for today.
All right, you're welcome. All right, take care, man.
Yeah, you too.
And I tried so hard to make you want to see someone else can never be like me. Well, let me in, let me go. And so my heartbeat plays to your song.